Good evening, everyone. I'm Malini Gopalakrishnan, and on behalf of Universities Press, I would like to welcome you all to today's webinar, Microbiology, Examination Preparation Tips for Undergraduate Students. The speaker for this webinar is Dr. Sonal Saxena. She is Director, Professor, and Head of the Department of Microbiology at Maulana Azad Medical College, New Delhi, from where she obtained her MBBS and her MD degrees. Dr. Saxena possesses nearly 3 decades of extensive teaching experience. She successfully completed the esteemed FEMA Fellowship in 2023 and was awarded the WHO Fellowship in Antimicrobial Resistance at the Karolinska Institute, Stockholm. Additionally, she serves as the Secretary of the Indian Association of Medical Microbiologists. Given Dr. Saxena's vast teaching experience and passion for microbiology, I'm certain that we are all in for an engaging and informative session. Before I hand over to Dr. Saxena, I would like to remind participants that they can key in any questions they may have for Dr. Saxena in the Q&A box. She will address your queries at the end of the webinar. Please remember that there is no question too elementary, so fire away. Dr. Saxena, over to you.
Thank you, Malini, for those kind words. Yeah, so we'll have a screen sharing. And before we begin, first of all, I would like to welcome you all to this, a very interesting and a very unique webinar on exam preparation tips for undergraduate students. And I'm sure all of you with the upcoming exams are really looking forward to getting some tips from a teacher. So without wasting any more time and giving you more time to ask us or ask me some questions, we'll start. So next. So when I talk about microbiology, the first thing that comes to my mind is why should you study microbiology and what kind of shelf life does microbiology have? Because most of the subjects that we study, the shelf life is only till our annual examinations. So what is the shelf life of microbiology? Now, as a teacher and as a doctor for so many years, I realized that clinical microbiology is 50% of your clinical medicine also. Because in India or in a country like ours, we deal mostly with infectious diseases, and the base knowledge that you acquire from clinical microbiology basically answers all your questions on infections. Now, for example, you may not get a question today in microbiology on what are the viral markers for hepatitis B infection. The same question you can also get in your medicine 2 years later. So that is why I always say that microbiology is not only for infections. Now, there are certain other branches like industrial microbiology, which deals with the making of bread, wine, enzymes, antibiotics, environmental microbiology, molecular biology, which deals with recombinant microbes and vaccines, genetics, and of course, infection control and public health. When we come to these infections, we are again very much in awe of these infections, and that is why we need all our knowledge of microbiology. So, with the continuous travel, with the kind of that we brought our world together, bioterrorism and pathogenesis of disease, the basics that we form right now in our phase 2 are going to play a very important role. Next slide, please. So it is microbiology not just to pass your exam, but also to understand that what is the burden. Now, you all might say, although this comes from a 2011 study, that you might say that the mortality and morbidity, it's a very small section of your pie, just a 1/4. But next. So, but what happens is that it is this attribute of infectious diseases which lead to a non-infectious. Next. And it is also the non-infectious which leads to these infections. So the whole pie becomes the playground for clinical microbiologists. When you have a diabetic patient who acquires the infection, it is a non-infectious disease, but you end up talking about the infection. Or maybe because a patient is suffering from a particular disease, he might be prone to a non-infectious condition. We all know now of the gut-brain axis, where they say that it is the microbiota of your intestine which determines whether you will get dementia or Alzheimer's later in your life. Next slide, please. So what all is required to study in microbiology? You all are familiar with our sub-branches where we talk about general microbiology, immunology, bacteriology, virology, mycology dealing with fungus, and parasitology dealing with parasites. So we love to call it a fantastic world because it is our world, as we say, and we are still trying to understand these different microbes and find out the solutions as and when they have an interaction with the human body. Next slide. So when we talk about uh, the curriculum or the assessment, where are we right now? One of the most important thing which has happened in 2019 is that we have a competency based medical curriculum. And when we have a competency based medical curriculum, we need to understand how these competencies look like. So just to give you an overview of a competency to the undergraduate students, I would like to tell you that there is a competency which says that you should know about HIV, what you should know, the etiology, the pathogenesis, how the complications happen, how the disease evolved, what are the various opportunistic infections, how do you diagnose it, prevent it, and how do you manage this condition. So, this all, as I said earlier, is not just applicable to microbiology, but will also be applicable when you do your medicine or when you do your surgical part. And the NMC is also suggested how it is to be taught, how it is to be assessed, and that is where all your this thing comes along. So I'm not going to much touch about the skill assessment part, but I will talk about the written and the viva voce part as and when I be come across. Next slide. So similarly, you have an enteric fever, diarrhea, dysentery, and so on and so forth. So generally, we divide microbiology into three parts. One is the general part, then, of course, the immunology part, which is your protection from these infectious diseases. And thirdly, from a microbiology, which is applied to infectious diseases, which changed drastically with competency based medical education, where it shifted from an organism focus to a syndrome based focus or a disease based focus. So instead of talking about Salmonella typhi, we talk about enteric fever or typhoid, and the parasitology gets integrated. So when we talk about earlier, if you remember, any teachers who are there in the webinar would remember that earlier we used to teach malaria separately and we used to teach enteric fever separately. Now all these come under our infections of blood and cardiovascular system, and so these systems have changed a lot. All right. And there are certain introductory part which are required from bacteriology, parasitology, virology, so that when you study the part 3, which is applied, you have a base knowledge about these organisms. So next slide, please. So when we talk about general microbiology, what are we supposed to study and what is important from an exam point of view? For example, if you talk about microscopy, now any of these microscopy techniques, whether we are talking about fluorescent, phase contrast, any of these can come as a short note to you. It can be asked in your skill assessment and it can be made into an MCQ. Say the what is the principle? Like I've added a few questions here. Which microscope is based on the principle of refractive index? What is the resolving power of microscope depends upon? And any of the principle or working or taking care and what is the use, advantage, disadvantage, any of these can be asked. Next slide, please. Attached to microscopy is your staining techniques. So whenever we deal with these basic concepts, we talk about what are the various principles of staining, what is the relevance in clinical microbiology, what is a bacterial growth curve. So when we're talking about the basic bacteriology, we want to understand what a growth curve is, what is the relevance of that, and all these are again your short notes. Then label diagrams of a structure, flagella, what is the difference between gram positive and gram negative, what is the how does a spore look like, how does a cell wall work, what are the various cell media, culture media, what are the various biochemicals or identification. And what actually happens here is that there are a lot of MCQs and there are a lot of viva voce questions which get built on this, particularly on the part of the culture media. You can be given a media in the spot and you can be asked, for example, you have a nutrient agar and they can be asked, what is it used for? How do you sterilize it? How will you check the quality of these media? But these questions are usually not part of the theory examinations. maybe just an MCQ. Which of the following is a selective media? What is RCM used for? What is the purpose of using agar agar? Does it have a nutritive value? Does it have it's only a solidifying component? Does it provide a carbon source? Then similarly on biochemicals, it can be part of the spotting or OSPE as we call it. Depends on your university what you are doing. You can be asked about the principle of a biochemical reaction. You can be asked to identify, use what are the organisms which give it positive, what are the organisms which give it negative. And then with the outcoming of COVID, there is too much of stress on molecular diagnostics. What is PCR? What is real-time PCR? And what are its various modifications? And these are not only short notes, but they are sometimes a long question as well, where you can be given a small scenario as to, let's take an example of COVID. You can be given a scenario that there is a person who's come to the hospital with complaints of, say, cough and fever and cold, and in order to quarantine him, nasopharyngeal swab has been taken. What test would you like to do? What is the principle of that test? What are the advantages and disadvantages of the test? So you're supposed to write about the real-time PCR, and this scenario makes it a little tough for you to first identify what I'm going to write. Next slide. So in when we come to systematic bacteriology, as I said, there is a little bit of stress on the organism part, because when you come to part 3, which is the applied part, you will be dealing a lot with what we call as the what are the infections, what are the presenting symptoms. So before that, you should have certain knowledge about the organisms. Say if we talk about say rheumatic heart disease. Now rheumatic heart disease, the causative organism, what does it do? How does it enter? How what will is going to cause? So the portions of this systematic bacteriology should not be left behind. Very often I have realized that students start play a lot of stress on the applied part. They know everything about rheumatic heart disease. What are the features? How is it diagnosed? But the moment I ask them, what is the pathogenesis of the disease? Then zilch. Because what has happened is that this portion which was there as part of the concept of pathogenesis has been neglected by them. So, how does the exposure to a pathogen occur? How does it adhere? Now, in order to cause a disease, the first thing that an organism has to do is enter the host. And it will enter the host from a proper, what we call it as the site has to be a proper. For example, any organism which is causing GI tract has to be ingested. If it's causing a diarrhea, if it enters through respiratory tract, it's not going to cause infection. And then it will encounter its cell. For example, it will encounter, if it is going through the GI infection, it will encounter the stomach acidity. Does it have a mechanism to bypass that acidity? The infected dosage would be very, very high if it has to bypass. And then it's going to deal with the host innate mechanism. The thing here which comes is, say, the bile salts, the mucus which is there in the intestine. Does it have a mechanism to deal with that? Then they will invade the target tissue, and then there will be a predilection for certain tissues. For example, a hepatobiliary infection, the organism will straight away rush towards liver. Something which is causing a large intestine, then it has to go to the large intestine, say giardia. If it is a vibrio, it has to attach to villi of the small intestine. So it will rush there. And once it has found its niche, it has been able to adhere or invade, depending on the type of pathogen, it will start colonizing. And once this colonization occurs, it starts multiplying. Once the organism starts multiplying, it has reached a stage where it is in its home, and once they have settled down, then they will start producing toxins, enzymes, they will start interfering with the cellular metabolism, depending on what they cause, and they will inhibit these defenses and cause a clinical disease. So and therefore, you need to understand as to which syndrome is caused by which organism. Meningitis is predominantly caused by this organism. Otitis media is caused by this. Very often you get confused. Is it Streptococcus pneumoniae or Streptococcus pyogenes? So unless and until you read these portions of basics, you will not understand these differences. Today only I was checking a paper and I found that the few students had written meningitis. The first cause is Streptococcus pyogenes, whereas probably they wanted to write about Streptococcus pneumoniae and not pyogenes. Next slide, please. So, in order to understand this pathogenesis, it's very important that we do these, kind of what we call it, various kinds of things that they follow is is very important. So, what happens is all the text which is there and all the books which are there will give you as to what this material is. For example, what are the virulence factors it is producing, what are the various toxins it is producing, and what are the various mechanisms that it has. So if you see, there are multiple mechanisms that you will find. You will have a cell associated factor, you will have cell associated proteins, you will have enzymes which are produced extracellularly, you will have toxins which they secrete. Now, for example, this is for Staph aureus. Now, Staph aureus, if you see this portion, when you're studying systematic bacteriology, it will tell you that these are the toxins which are there, and they are given very easily in the tabulated form in my book, and where you can pick up these toxins as to what protein A does, what coagulase does, what clumping factor does. And depending on later on, when you're studying your diseases in the applied part, you will have a better understanding and you will be able to reproduce this better in your answer paper. For example, if I ask you a Staphylococcus food poisoning, then you know from this table and this table that if you put together, you have all the information. You know that it is an enterotoxin which is causing it, and it is a preformed enterotoxin, and it, it is a super antigen, so it will be acting very fast. Next slide, please. So all this information which is given in the initial chapters is extremely important. Similarly, you have virology. Now, various pathogenesis, what are the characteristics, multiplication, route of entry, all these can be either a short note or an MCQ. Then is this a DNA virus? Is this an RNA virus? Which of the following is not an RNA virus? Which of the following is not a DNA virus? And these are very simple to understand and mug up. For example, if we look at the DNA viruses, there are very few DNA viruses. So, if you remember those DNA viruses, say smallpox or herpes, you will remember that the rest of them are all RNA viruses. Very often students ask this question, how can we mug up this whole list? So, you learn by exclusion. So, what you do is you either make a mnemonic which suits you, or you remember the DNA viruses, and then the rest of all are RNA viruses. Then what is the immunity to these? What are interleukins? What are cytokines? We'll come to these during immunology also. Then again, lab diagnosis. How do you grow these viruses? What is an egg culture? What is a cell culture? What is hemagglutination? All these again are short notes. Bacteriophages, prions, very favorite short notes on prions and bacteriophages. And the MCQs, like what is the first initial response? So the first would be that it produces an interferon and then it creates a cell-mediated immunity. Because all the viruses are going ultimately inside the cell, and it's very important that you remember anything which goes inside the cell is going to stimulate a cell-mediated immune response. So these are the small tips, which you remember. Sometimes you sit in the exam and you get a mental block. In those situations, these kind of tricks, if you've learned, will help you a lot. Next slide, please. So, coming on to parasitology and mycology, again, lab diagnosis, what is the classification, what are dermatophytes, what is a yeast-like fungi, what is mold fungi, and similarly in parasite, what is a protozoa, what is a helminth, what is a cestode, and generic parasites, what is the life cycle of cestodes, what is an intermediate host, what is a vector, what is a definitive host. All these things are not only MCQs but short notes also. And then our favorite chapter of all microbiologists across the country is sterilization and disinfection. Because every line of this chapter is not only useful for your exams, but also for your life. For example, CSSD, the Central Supply Department, if you do your PG in anesthesia tomorrow or surgery, this is something which you will require. How endoscopes are processed, how endoscopes are washed, what are the various disinfectants, how do we test for these disinfectants, what are the various antiseptic solutions, how do I clean the skin before taking a sample is going to be useful all your life. What are the quality indicators? So if you are in CSSD and you have an autoclave or you have an hot air oven for your sharp instruments, you have an autoclave or you have something, a plasma sterilizer, you should know how it works. You should know how it's, what is the principle, what you will use to check its efficiency. Because uh, in Maulana Azad, many of the operation theaters have got these small autoclaves or hot air ovens to maintain this. What is the value of gamma radiation? How do I check it? So all these are very important for exams point of view. Then there is one competency that says choose the most appropriate method for sterilizing. So if I have to sterilize something which is made of metal, I should be knowing how to sterilize it. So that is competencies that you have. So it's going to be useful this chapter even in your practical examination. Coming on to the epidemiological part, the host parasite relationships which are there, the virulence factors it produces, what are the exotoxins versus endotoxins, another favorite question. So from the epidemiological part, you should know a little bit about the factors and exo and endotoxins. I think that's the only part that is of great importance from here. Then the antimicrobials. For example, mechanisms, what are their methods? What are mechanisms? How do beta-lactam antibiotics act? What are the mechanisms of resistance to these antibiotics? How do fluoroquinolones act? What are the mechanisms of resistance? So, stewardship nowadays, it's a very important question asked. Then again, healthcare infections, what is central line associated bloodstream infection? What are surgical site infections? These are not only short notes but also MCQs. Biomedical waste and spill management, again, not only from the theory point of view but also from a practical point of view. Hand hygiene and PPE, donning and doffing. Now, it depends from university to university. So, in our university, we have a competency, we have a exercise to address this competency of PPE, where we ask them if you are supposed to take a sample. Say you have to collect a blood sample from a patient. What all PPE will you wear and in which order? Or it could be if you have to collect a nasopharyngeal swab from a COVID positive patient, how what PPE will you wear and how in which order? So here the two PPE will be different. Maybe to collect a sample, you will only wear gloves. But if you have to collect a nasopharyngeal swab, you would like to wear an N95 mask or a surgical mask. You would like to wear a headgear or a eye protective gear and a gloves. So it depends on what. If you are doing a suction, then you require a gown and a shoe cover and a head cover as well. Next slide, please. So all these, if you make these snippets, they come out to be very useful during your examinations. In the textbook, you can put a small highlighter part or you can put a small post-it so as to remind you that this is what I have supposed to revise before my practical. Next slide, please. So this is all about, I think this is all about general microbiology. Now we come to the immunology. Now in immunology, very often I have found the students get very confused. But I feel immunology is already your third revision. You've read immunology in biochemistry. You've read majority of this immunology in pathology. And in microbiology, you read it again. The immunology which is taught to you in pathology and in microbiology is not going to be different. The immunology is going to, principles are going to remain same. So don't get confused. What we ask is what is innate, what is adaptive. Pathology people want to know about BNT cell, MHC, Then we ask you about adjuvants because vaccine is an important component, live and killed vaccines, active and passive immunity, humoral and CMI, all the tumor immunity and autoimmunity, immunodeficiency is taught to you in transplant immunity, is also taught in pathology. Then the various antibodies. A definite short notes for most of the universities is short note on any of them, GAMDE, or a short note on antibody, cytokines, interleukins, hypersensitivities, type 1, 2, 3, 4, anything can be asked in MCQ as well as a short note, even a long question. If you've seen the new Anand Narayan, you will find that each hypersensitivity begins with a small case study. That there is a V-lymph reaction or there is a asthmatic reaction. Now, what is the principle? What type of hypersensitivity it is? What are the mediators of this type of hypersensitivity? How will you detect it? Then, what are the various antigen antibody reactions? ELISA, CLIA, precipitation, agglutination, these complement fixation reaction. All these are favorites. Any of these can be a short note. ELISA, particularly, the various types of ELISA, the differences between ELISA. Then antigens, haptens, toll-like receptors, all these. Then, for example, from antigen, if you can't, I can't give you a short note, I'll give you maybe a small MCQ saying which of the following is most immunogenic: protein, lipid, polysaccharide, or monosaccharide. Next slide, please. So, immunology will basically cover your immunity part. Now we come to the third part, which is usually a very complicated part for you all to understand, which is an applied and a scenario based part. Now, from the applied part, you are asked majority of your questions. The scenario based means that you get a small case. For example, you can see this case here that there is urethral discharge and dysuria, and the patient has had a history of unprotected sex. Now, what is the first thing which strikes you here is that the history of unprotected sex means this could be a sexually transmitted disease. So, whenever you read a history, either on the question paper or in your answer paper, write down the keywords which you are getting from this. Because this is usually a 10 marker, and you lose complete 10 marker if you can't reach a diagnosis. This case history is very kind to you. It's giving you a diagnosis itself that a diagnosis of gonorrhea was made. So here it's almost like it that this kind of a history. But if I were a student, what I could do is I could stop the history right here. And I could give you one more question which asks you, what is a diagnosis? How have you arrived at a diagnosis? So how have you arrived? There is a purulent urethral discharge. Now think in your mind, what could be giving a discharge? There is a dysuria and painful urethral discharge. There is a painful ulcer. There is a painful ulcer. There is a watery discharge. There is a curdy discharge. So all those factors you should bring in here and reach what your diagnosis is. And it's not difficult. Believe me, if you break it down, it's not a very difficult thing. So let's look at the second history which is there. That a 27-year-old male truck driver presented with this. Now the ones which I have highlighted in red are actually your keywords. There is a painless genital ulcer. So what comes to your mind? First thing which comes to your mind is this could be a syphilis because it's a painless genital ulcer. If it was a painful genital ulcer, we could have thought of something else. 10 days duration. That means it is an acute condition and it has a circumscribed and it has healed now because it's a 10 days duration. It has healed. And there is an inguinal lymphadenopathy where there are discrete, rubbery, non-tender lymphadenopathy. Next. So what do we see here? Next, please. Next slide. We see that there are certain questions which are associated. What is next? Next. What is the provisional diagnosis? How do you diagnose this condition? So this history, yeah, can we go back, please? So this history should be telling you that we are talking about syphilis. Can we go back to the previous slide? Yeah. So what we are talking about is asking you what is a genital ulcer disease. You've already thought of that in your mind when we talked about genital ulcer. And how will you confirm it? So this looks like a primary syphilis because there is an ulcer with an inguinal lymphadenopathy. Syphilis again will have primary, secondary, tertiary, and this doesn't look like a secondary, which should actually be a maculopapular rash. It doesn't look like latent because there will be no symptoms 4 or 3 months before. And this doesn't look like congenital because we are talking about an adult and not in a neonate. So, and tertiary, there is no Tabes dorsalis or there is no neurosyphilis history. So, this looks like a acute primary syphilis and it becomes easy for you to write now. Next. So, you of the definition. If this is enteric fever, what is the definition of enteric? Now, the definition which is given in Anath Narayan will be same as the definition which is given in Harrison because the clinical definition will remain same. So, if we are calling something primary syphilis or we are calling something enteric fever, the definition will remain same. Now, if you look at this slide, it has talking about bloodstream infections. Now, bloodstream infections, you have to understand there are multiple pathogenesis. And it is our favorite question to ask you what is pathogenesis. As a microbiologist, I never like to ask the treatment. I want to ask only about diagnosis and pathogenesis. So, what is the pathogenesis? Intravascular, what is coming? Extravascular, what is coming? What are the agents which are there in the bloodstream? How do they act and cause these bloodstream infections? So, what will be the clinical features? If there is a micro and it stops or circulate the blood, that is what is resetting your thalamus and causing fever, and the complications, and what is the lab diagnosis of infective syndrome. Next slide, please. So, like this, you will move for each and every syndrome. Next slide, please. So, when we talk of these syndromic infections, you should, there are very catchy, uh, lab D kind of a situations which are given. Which are your revision points? When you sit down, if you have an exam tomorrow and you have a very limited time, these are the things which you can revise. For example, plague, what are the biosafety levels? What are the samples that you can take? How do you do their microscopy? How do you culture it? What is the optimum temperature? Or does it need carbon dioxide or not? What are the main media? This will also help you to handle your MCQs. And then what are the various diagnostic strategies, then these flow charts. Now, even in the exam, if you draw these flow charts, practice them before going for an exam, this will fetch you full marks because it's very easy to get and it is very easy to comprehend as a teacher and to make an opinion that yes, student knows this. Next slide, please. Instead of mugging up, try to reach the diagnosis as to think of yourself on the other side. If you were a patient, what would you like? The assessment is usually a combination of a long question, which is 10 marker and which is scenario based. You have about 10 to 20 MCQs depending on the university. And you have certain short answer questions. Now, these short answer questions could be either write a short note on, which is about 200 to 300 words, or it could be enumerate 5 DNA viruses, enumerate 5 RNA viruses, enumerate the cell lines which can be used to diagnose viruses, enumerate the various molds that cause opportunistic infections. So they require a specific answer. And these, because you are MCQ generation, I always like to call you an MCQ generation. You come from a very competitive NEET UG exam and you have to give again a NEET PG exam or a next exam. You're very good in your MCQs. And the short answer questions just built on those MCQs. Next slide, please. So when you are dealing with writing an issue, always remember that there are certain points or highlights which are to be taught. Now, in the 13th edition itself, can we go to the next slide? In the 13th edition itself, we try to cover a lot of things which are these flow charts, these diagnostic boxes. We've integrated the CBME competencies with the page number. This helps not only the student but mainly the teacher. And sometimes you have your curriculum is designed in such a manner that history, the initial general microbiology and immunology is covered in paper one, and the applied part is covered in paper two. Next slide, please. So this helps you to revise it. And then there are certain, next slide, please. For example, you have the applied part. For example, cardiovascular and bloodstream infections, which you have. There, in the initial itself, the chapter navigation will tell you what all is covered here. So if you want to read about babesiosis, you want to read about Crimean Congo hemorrhagic fever, even after you finished your microbiology, it gives you a very good reckoner. And in the beginning, it tells you that we are going to talk about which all syndromic diseases. We are going to talk about ARF, about infective endocarditis, myocarditis, infections of bloodstream, PUOs, and those which are caused by presenting primarily as fever, or if they are viral, or if they are parasitic. Next slide, please. So all malaria, kala-azar, chikungunya, dengue, everything is covered in this chapter. This is one of the biggest chapters in the book. And then you have these case studies. Gonorrhea, I've already told you. And then you have these, say for pneumonia. Before every organism, these are these case studies which cover bacterial pneumonia, viral pneumonia, nosocomial pneumonia, and the related questions. So usually the chapter starts with these case studies, and then the subsection starts with the case study, and the first few lines tend to answer these, and then it goes on to talk about the particular organism. Next slide, please. And the organism is already to a certain extent being covered in the systematic bacteriology part. Now, this list is a color-coded list, which usually you are asked not only in MCQ, but also we wanted you to have a visual image of this. Because as I said, microbiology is not just limited to your exam in phase 2. So if you have an image of this, you will remember that, oh, where it was UTI, E. coli was written in red. So that means that E. coli is the most common organism. Or amongst gram-positive, Enterococcus was written in red. So we are dealing with the most common organism here. Now in meningitis, in neonates, I had these 4 organisms which were written in red. Next slide, please. So this is to give you a visual picture as to what you're dealing with, even when you see a clinical case. And then these comprehensive tables. Very often you will get a question, what are the agents causing bacterial food poisoning? Classify them as per their incubation period and symptoms, and we've made things easier for you here. What are the respiratory infections which are dealing with? What are the tests you will do? What is the antifungal agent you will use? Next slide, please. Because as I said, I may not be asking about treatment, but your university may be asking you. So pathogenesis are mostly in the form of a flow chart so that you understand. Try and understand a very basic thing in pathogenesis. It is usually cyclical. It goes from one to another to another. And that is why you see these arrows and these, how do they work, and if there is a sepsis or if there is a fluid imbalance, what is happening, how this bulla is forming, so that you remember these and you can put these as such in your exam. Very often students ask me, should we write point wise? Yes, it's better to write point wise because it gives the message that you know it. But don't forget to write the content. Don't write the title and be done with it. Next slide. Remember to write the content along with it. If it is entering, how is it entering the cell? If it is producing a toxin, which toxin it is producing? And again, the concepts. For example, if you have a diagnosis of a particular disease, then what do you do initially? If it is an IgM, what does it mean? If it is an IgG, what does it mean? Classification of mycobacteria, what is typical, what is saprophytic, what is atypical, what is non-cultivable, and what is what causes skin ulcer. So that you know, even from an MCQ point of view, that yes, I remember this image and this is how. Very common MCQ is what causes my skin ulcers. And you have an answer immediately. Next slide, please. So these are the algorithms, as I was mentioning. How will you approach a diagnostic strategy for meningitis? This is for pneumonia. What a sample will you take? What will you do with these samples? For example, you can look for antibody, you look for a biomarker, you can culture it for virology, or you can culture it for bacteriology. And if you have a bacteria, you would like to do an antibiotic sensitivity. Microscopy can give you a rapid diagnosis or even a rapid, latex or any such test which may be there at certain point of time. Next slide, please. I think we are almost ending. These are the life cycles. The life cycle by itself are complete. If you're asked a life cycle, say you are asked a life cycle of amoeba, which is probably the simplest life cycle, you don't need to add any other information other than this. What is a quadrinucleate cyst? How does this quadrinucleate cyst travel? What does it do? How does it look like? Everything is there. Say this is for Ascaris, fertilized egg is ingested, so it's the infective form. This could be an NCQ. What is the infective form? Fertilized egg. How does the rapidity form larva release? Where does it molt? So 1, 2, 3 molting. And how does it work? And how does the adult parasite looks like? Next slide, please. So these life cycles by itself are totally complete. And the summary in boxes, which is a completely a new feature and very helpful for you to last moment revision. We always, all of us, whether it is you or me, we all get overwhelmed a day before the exam. So, in order to handle that, these boxes will help you a lot. What is there in microscopy? What is there in culture? How do you identify from that culture? And how do you go about putting up the biochemicals? Next slide, please. And they are not very, very short. They give you sufficient amount of details. Now coming to an AdCom part. Next slide. Now, AdCom, as you all know, attitude, ethics, communication. We had divisions now. And in microbiology, the competency 2.2, 2.3, 2.5 is covered for the batch 2023 and 2022, which is writing one batch, which is writing the exam, and one which has just come in second year. For you, these are the competencies. For 2024 batch, the competencies have changed again. And this chapter will have to be modified later on. But this also tells you about the uh, what do you say, what you're supposed to write if you have a question. Now, this question can be asked in your as part of your OSPI, as we do it in Delhi University, or it could be part of your theory exam, which is there. So there is a case, which tells you that there is an ethical dilemma here, or if is healthcare a right. Healthcare is a right is a very important aspect where it tells you what are the social implications. You feed 200 people, and out of those at a bandara, and out of those 200 people, there are 150 people who can easily afford a meal. They are super rich. They're coming in car and eating in temple. Is it ethically right to feed everybody the same kind of food? Or it should be meant only for those people who cannot afford the food? Or is it like a prasad and it's to be given to everybody? Now, these are the ethical dilemmas. These were brought out by my own students when I interacted with them on this topic. So these are some things that will get you thinking. So there are case studies which get you thinking. And these case studies can also be asked in the examinations. So whenever you write an AdCom answer, remember that there are certain principles involved which you anyway have to write. For example, what is an ethic? What is a bioethic? What are the 4 principles of ethics? That you have to be correct. Very often I get students to see and say, ma'am, ethics is a personal thing. What I may perceive as right, you may not perceive, and how will you mark me? So you don't forget about that. You don't think about that. You think about the facts which are there. The 4 pillars of ethics will remain the same. And what are the missing links in providing healthcare to everybody on this earth? Those missing links will remain same. There is a PM Ayushman Bharat, and not everybody is literate enough to come to that. So those missing links will be there. And then people who can actually afford healthcare and still get that card They will be misutilizing it. So those things will remain. But there are certain facts which are there in this chapter, which you can use to build upon your answers for ATCOM as well. So I think we've come to an end of this. And yeah, this is something which I wanted to show you. This is our practical or skill competency blueprint for Delhi University. As to what we give, we usually have a microscopic skill part which the student performs either in presence of an examiner as an OSPE or like a practical, and the rest a clinical problem. What will be the sample that you collect? What container will you? What precautions will you take? So this is how we run our examinations. So I thought I'll just show you as to how this distribution of practical examination works. So next, please. Yeah. You mentioned all the parts and you have this. And in addition to the practice, you have 1200 questions. Somebody, I remember before the session was asking in the Q&A box that how do we practice microbiology preparation? This is one of the aspects of practice. And I think the seminar has covered how do you learn microbiology. And there are a few questions which are there, Dr. Chat box. Can we follow one answer and skip Apurva or Ananda? You are most welcome to use any book that you feel comfortable with. But if you're in India, you will require an Indian perspective to deal with these infections. For example, the world doesn't care about typhoid. But in India, every third or fifth sample is positive for Salmonella typhi during the rainy and the summer season. So the Indian book gives you an Indian perspective, and they teach you how to tackle these situations. Following markings and previous year questions is beneficial or studying everything? I think I have answered this in my. Why did it take so long to amend classification? I am not the right person to answer that because it is mostly for the policymakers to decide and suggest a method to test your own preparation. There are a lot of questions which are given at the end which you can practice. PYQs you can use to practice. Don't use them to study. Because of the system-based chapters, if you study the systematic bacteriology chapter, which talks about the organisms in general, then I don't think you will ever get confused. It is the teacher. So we've learned it the organism way, and now we teach the system. The student should not get confused. He's studying microbiology for the first time. Choice and preference of lab diagnostic tests must be emphasized. We should not start with very wisely, Smita. As I said, and all the flowcharts that I showed you, all these basically should start with your microscopy, culture, then you go down to the advanced. And we do not expect, I don't think any teacher expects an undergraduate student to talk about MALDI or PCR at all, leave alone in the first line. And this is called object throwing in our medical education, that we say you throw big words and you think the teacher is going to be impressed. That does not happen. What are your views on the book by Apurva Shastri? I am nobody to comment on that. How do we integrate our preparation for university with that of prof? I didn't get this question. If you prepare for university, you're already preparing for your professional examination. How to remember lab diagnosis easily? Please see the flowcharts there and those boxes. They help you. Read book or PPT. Please never read PPT. PPTs are meant for your teachers. Read the book. Book is meant for you. Organism-based microbiology to systemic bacteriology, microbiology, I think I've already covered. Rational way to answer the question in university exam. Rational way is to write to the point. Use bullets whenever possible. Make a diagram if you think it is. Make a flow chart if it is possible. And that's how it's going to work. Practical is now almost integrated with the theory. Practical, if you see in microbiology, is derived totally from the theory. So if you read your theory well, you will have your resources for Viva and your OSPE. And how to study microbiology in an easy way, like less time consuming. The more you invest, the more you get, is how life goes by. How can retain microbiology better is to study it regularly. If you think you can study microbiology in the last 1 month, it's not going to work. For any subject, it's not going to work. So if you study regularly and slowly, it will work. How do you integrate your prof preparation with PG? Okay. Yes, MCQs. Now MCQs are part of your prof preparation. So in MCQs, learn to mark your book in such a manner that you get your MCQ right then and there. Pathogen is what is the most attractive thing we can write on our answer sheets for getting maximum mark? Please write correctly. That is what is going to fetch you your correct marks. If I ask you lab diagnosis of enteric fever and you write MALDI in the first line or PCR or scrub typhus PCR, then I'm not going to give you marks. That's my opinion. Other teachers may vary, but that's how it works. You have to write what is relevant, easy, can be done very easily in lab and with less expenditure, and then move on to the higher aspects. Flowchart or the diagram or whether you write, it's one and the same thing. When you write a flowchart or a diagram, what happens is that you get a flow of this, and we understand that you've understood the concept. So if you're short on time, you just make a flowchart or a diagram. Or if you have time in the paper, you can describe that flowchart or a diagram. Okay, I think Dr. Sudha, I have taken the questions from here. Or any other?
Yes, thank you, Dr. Saxena. That was really, really educational. And if I was a student and I had all this information by my side before I started reading microbiology or just before I was going to the exams, it would be just uh, absolutely brilliant. Thank you so much. And that was one of the best presentations I've attended. I just have, see, as I said, there is nothing which is considered as an elementary question. And my basic elementary question from the student side is, how many papers are there in microbiology? And if there are, exactly, if there are two papers, is there a generic, a standard division of systems in the first paper versus second paper? I
Yes,
think that
actually,
is confusing a lot of people.
no, actually, it varies from university to university. But general microbiology and immunology is in the first paper. But like for Delhi University, we have cardiovascular, bloodstream, and gastrointestinal hepatobiliary in the first paper, along with general and immunology, and all the other systems in the second paper. But I made a paper for one of the other universities down south, and there I found that instead of GI, they have skin and soft tissue. So it depends from university to university, but mostly first paper will definitely have general and immunology, and all those, the other systems will go to the other part. One or two systems will be there in paper one. Another thing I want to emphasize here is very often there are certain things which will be common to both the parts. For
Mhm.
example, plague will be covered in bloodstream infections in paper one, but again, plague can be asked in paper two because it is a zoonotic infection,
Zoonotic.
and zoonotic and miscellaneous is usually covered in the second paper. But I always believe that if you studied for paper one, you know the subject and you can write it in the paper two as well. So that these some organisms will remain common.
Okay. Is there any anything in the book to help me track the organism across the book?
Yes, one
Because
thing
it's going to be, mentioned in several chapters.
I think we've given a table in the book where page wise and competence. I showed also one of the sections where
Yes.
they can go to those pages and they can find out. The other way is even we've tried to give reference anywhere. For example, in systematic bacteriology, if we are talking about staph, it's given in chapter so and so. It's given in chapter, Vibrio is given in chapter so and so. And then the index at the back also covers it as an organism
Okay.
wise.
All
So
right.
the index which is there, the enteric fever will be there, cholera will be there, So those page-wise references are there in multiple places.
That means that makes the students' job much easier. Another common problem the students have is to understand what is adequate for an undergraduate level versus postgraduate level. Where do you draw the line in the sand for this? Because if they are going to source multiple books, then there is a possibility of overreading, underreading. How do you
Yes,
get to that? And where does this book, how will this book help them?
yes. I'll tell you this book will help hugely. Most of the institutions in the country have both undergraduate as well as postgraduate teaching. So what I tell my postgraduates is that the degree on Andaran is going to give you a systematic approach, a system-wise approach to your microbiology. Now, when you're dealing with this approach, at the same time, go back and read because the requirement of a PG is much more. It cannot be covered by Apurva Shastri or Anand Narayan or any book. So if they have to read about, say, even Salmonella, they will have to open a Topley or Kohneman or any of these books which talk a lot of details about the cell wall structure, about the virulence mechanisms, about their detection. In cholera, they would need to know what are the various other factors other than the cholera toxin. Undergraduate, if he tells me about cholera toxin, I'm happy. But if the postgraduate is not able to tell me what a TCP is and what is the role of TCP in cholera, so they have to integrate along from the other books here. So this is going to cover their basics, create their fundamentals. So I always tell my PG students in the first year, read Nandarayan. And when you come to second year, you build on that knowledge and read the reference books.
So as an undergraduate, I'm safe if I were to, follow
Oh,
this book and
you don't need to go anywhere else for undergrad.
right. So
They have to study pathology, pharmacology,
true.
and they have clinical duties, and they have to get a clinical orientation. So I think one book is good enough.
One, yeah, that I agree. Ma'am, there's another thing as a student I always found. There are so many diagrams and flow charts, etc. Especially the diagrams. Do I, as a student, am I expected to reproduce all these diagrams in the paper? Which of these diagrams do I have to practice and internalize?
I'm given you two purposes. One is to make students understand. For example, if and the other is of course for them to reproduce it in the exam. Suppose I ask the question, differentiate the dermatophytes on based on their microscopy. Now they are writing microconidia are too many, macroconidia are flask shape. It's better to draw. No?
Ah,
It's
okay.
better to draw. So you just replicate those diagrams, you get 2 marks. Differences between gram-negative cell wall and gram-positive cell wall. Now, even if a line diagram they draw that these are the lipopolysaccharide and this thick is the trichoic acid in a gram-positive, I think it not only helps you understanding what they're trying to tell the teacher becomes very. Sometimes there will be flowcharts and diagram for only for them to make them understand. The bloodstream infection that I showed. It's for them to understand that there is an intravascular, there is an extravascular. So they can read about this or they can write it as a text. Depends on them in the exam.
On the same note, are the life cycles in parasitology to be memorized and reproduced? Because there are a fair few life cycles
Yes,
they have
yes.
to. Okay, so there is no escape from
Actually, no, there
that.
is it's an essential competency. That's no, and it's a favorite with microbiologists. So
Okay, so
see,
all students get up. Okay.
because the reason for that is, for example, if I look at malaria, if the students don't know that the malaria is going to, the parasite is going to leave the liver and come out in the blood, they will not understand that the peripheral smear has to be taken at a time where the fever is peaking. So,
Hmm.
for their understanding, but that is why we keep asking these things again and again to them.
Okay, so that you have made that very clear. Thank you, ma'am. There was a very interesting slide about the color-coded tables which you had showed, which are in the book. Now, as a student, do I take a shortcut? Am I allowed to take a shortcut and just retain the ones in red and, not worry about the organisms in yellow and blue, or
uh,
should I go through the whole thing? How will that color-coded table help me?
I always feel, and I always tell this to my both UG as well as PG students, is that if you read 10 things, you will remember 8. And in the exam, you will be able to write 4. So it's better to read everything. But what they do is that if something which is written in yellow, deep down in the line, they should not write it as the first. The red is for them to attract the attention. That red is the most important one. And that's how, if they tell me that for a urinary tract infection, the organism which is written in yellow is the most common infection, then obviously they're going to get a flag for that. But if they write the most common one above, then it's better to read everything so that you retain the most important ones.
Important. So it's kind of
If you read only the most important one, then you will not remember anything.
but it then highlights the relative importance of the organisms, which ultimately, when I go and sit in an exam, perhaps at least the top 5 will
Important ones
come
will
click into my. Same thing with the lab diagnosis, man. There are lovely. I mean, you've brought in a lot of summaries for lab diagnosis. For example, any particular infection will have a whole plethora of lab diagnosis. How do I figure out which is the most important? It's the same question I have. How do I make use of those table, that box you have given us?
All lab diagnosis basically should start with the sample collection. And that is what we have emphasized in those boxes also. You cannot have a lab diagnosis. Most of the students make this mistake. And we have a structured key in our college. We have a structured key where we say that the lab diagnosis will have out of 5 marks, we'll have 1 mark for sample collection, we'll have 1 mark for microscopy, 1 mark for culture, 1 mark for identification, and 1 mark for advanced things.
I see.
So if
Okay.
they like some begin the answer with Maldi, they're going to lose 4 marks straight away. And if they write a page on Maldi and they don't write about sample collection, then I can only give them 1 mark out of 1. I can't give them any more marks. These students don't understand that there is a marking scheme to each question. So if they have to, if you see those boxes, only the relevant portions have come there.
I think a student this would be one of the most important tips you have given, because microbiology, those case study questions and answers are the 10-mark ones. And this, I think, ma'am, you have emphasized brilliantly as to how they should approach even when they're reading the lab diagnosis. That is, as a student, I would be very, very grateful. Yes. Is there anything? Oh, yes. Ma'am, you have given a lot of MCQs, case studies, online resources. We see a couple of QR codes on the cover. So you have these online resources provided on the app. Is something we'd like to share with the student community as well.
These online resources primarily have the MCQs. They have certain case studies, and there is a class schedule for the teachers, a mock class schedule for the teachers, and the PPTs. I would not recommend the students to read the PPTs. I would recommend you to read, although the PPTs are built from the textbook itself, but it's always better to read the book in order to get a concept. But the MCQs, because nowadays we have an online generation. So if you can't carry your book, you at least have your internet. You can practice those MCQs wherever you are. Even while traveling in a metro or in a bus, you can use that resource and do your MCQ practice.
Thank you so much, Dr. Saxena. I think we have covered what the audience also has asked, by clubbing all these questions together. And we have tried to make it as student-friendly as possible, because this webinar is aimed at preparation tips for undergraduate students. Thank you so much. Now I will just hand over. Is there anything else you would like to share just before?
The question is that some people have a big handwriting and they write a content of half a page in 2 pages and get marks. But no, you can't fool a teacher. That doesn't happen. That is for you to believe. It never happens.
Was that a question? I never saw that. Okay. I think it would take more than that to fool you or any other faculty on that. All right. Thank you so much, Dr. Sakrana. I'll just hand over to Malini again for the vote of thanks. And it's been a brilliant session. Thank you so much.
Thank you so much, Dr. Sudha. On behalf of Universities Press, I would like to thank everyone who joined us for today's webinar. Your participation and engagement made this session a great success, and I hope all of you found it valuable. A recording of this webinar will be available on YouTube. You will find the link in the registration email that you received. If you wish to know more about the 13th edition of Ananthanarayanan Panikkar, which is the brand new edition that's come out, please scan either of the QR codes that are appearing on screen. And to all of you students, we wish you the very best for your future endeavors. A big thank you to Dr. Saxena for sharing her time and expertise with us. I'm sure that your insights on how to approach the study of microbiology will be incredibly useful to medical students. The practical tips and thoughtful advice you shared will no doubt help them navigate the subject of microbiology with more confidence. I would also like to express my sincere gratitude to my colleagues at Universities Press and Orient Black Swan, who worked behind the scenes to make this event possible. Your hard work and coordination ensured that everything ran smoothly. Thank you all for being a part of this experience, and we look forward to seeing you at future events. Have a great evening.
Thank you.